Hello, my name is Derek Parker. I'm the tissue regenerative therapist here at SoftWave Therapy Columbia, and today we're doing an informational video kind of aiming to answer any questions new patients or people looking into SoftWave Therapy might have. So let's dive in. So SoftWave Therapy was designed to help your body heal better. We want you to feel better, but our technology does not in it by itself heal you. It helps you heal you, and we'll dive into that later. But it's a type of tissue regenerative technology. Okay. So here's a quote I put at the bottom just to start us off, kind of the why behind SoftWave Therapy Columbia. No one should have to settle for living in pain or with a chronic injury. That's by John Warlick. He's one of the guys that helped create this technology that's changed so many lives. But that really gets to the why behind why we do what we do. We learned that 1 in 3 people live with chronic pain and do nothing about it. And so SoftWave Therapy is here to offer the fact that you don't have to live that way. So what is SoftWave Therapy? I think that is a great question. What does treatment look like? How does it work? Who made it? When was it made? What can it do for me? What can it do for my friends? What can it do for my grandma? I think these are all great questions, and we have answers for all of them. But the question I want to hit first before we dive into anything else, because it's the one that everyone cares about, is, does it work? We all don't really care if it looks cool. We don't care if it feels cool during treatment, if it sounds crazy, if I had a crazy experience during treatment, if the guy that's doing the technology, whatever, is fun. Does it work? In the end, will I get my life back? Can I achieve painless range of motion? And the short answer is yes. Yes, 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 yes. It works. We put one of the testimonies of one of our patients on here. He is now a dear friend of mine. His name is Jeff. Jeff came in with neuropathy in his feet. Couldn't really feel much from knees down. Shins were kind of numb. Feet hurt. It wasn't crazy, but he was tired of living this way. He heard about SoftWave from a friend, came to our office, and came to our door. And one thing I've learned is people come to us not out of inspiration, but out of desperation. And so we're here to get people's lives back. We're kind of a replacement for surgery and stem cell injections, which we'll dive in later. But back to Jeff's story. So Jeff came in, we did about 4 treatments on him, and then one day he comes in and he tells me this story. So Jeff was texting on his phone one day, and his dog starts licking his shins. Jeff has not been able to feel his dog lick his shins in who knows how long. Well, on this specific day, he bats his dog away, goes, stop, stop. And then he just freezes. He says, oh my goodness. Liz, get in here. Calls his wife in. Says, I just let the dog lick my shin. And his wife is just joyed because she hates it when the dog licks the shin and he does nothing about it. She'd always say, Jeff, would you please bat the dog away? He said, I'm sorry, I don't feel it. Well, now he feels it. So he came in and he couldn't even walk up and down the stairs without a pain. And after 4 treatments, that's not even the full treatment plan, he was able to do so with no pain and feels dog lick his shin. So there's a lot of stories like that, including mine. I tore my labrum in my shoulder competing for the University of Missouri. I was on their track and field team and threw hammer. One day doing Olympic weightlifting, I held a snatch position a little too far behind my head. And that's kind of when my pain started. I remember that, and started doing physical therapy for about 6 months. My shoulders got stronger, but it hurt like crazy all the time. It would wake me up in the middle of the night, 2 a.m., and just wasn't really sure what to do. Talked to some older men, and they're like, yeah, I have pain like that too. You're just gonna have to live with it. So I said, okay, I guess that's my fate. Just get used to the pain. Well, not necessarily. When I got introduced to SoftWave Therapy, Dr. Maxwell, he did about, not even a full treatment, like 2 to 3 maybe. And I remember the first night, it was the first night in 2 years that I slept with no pain in my shoulders. And now, I think 5 weeks after we only did 2 or 3 sessions, I still feel no pain. Now, that is after a lot of therapy that I did. So maybe that helped more, but a lot of cool stories like that. People are getting their life back. They're not in pain anymore. That's what we're going for. So what are the benefits? So our technology, it helps modulate inflammation by increasing blood supply. So it helps generate angiogenesis. That's creating new blood vessels. A regular stem cell injection goes direct into the spot that you're treating, say your knee, but it does not increase angiogenesis. It's just stem cells located there. So that's kind of one of the awesome side benefits of why we're better than stem cell injections. But more importantly, back to the benefits, it helps stimulate and activate stem cells. So this is where we kind of dive into the science. So every time our technology passes over hot spots, it contracts tissue cells to release exosomes that turn on the toll-like receptor 3 in your immune system and tells it to initiate stem cell migration from the area to the area we're treating from your bone marrow. And so stem cells are cells that can turn into any cell localized that they're working on. And so the stem cells are migrating to the area. It's helping repair and regenerate tissue. And as your tissue regenerates, it helps reduce acute and chronic pain. So now with the slide, you were able to explain to your friends how SoftWave therapy works. Yay. So there's three things we want you to keep in mind when thinking of why you should choose SoftWave therapy. And one of them is you can say goodbye to stem cell injections. So most people, stem cell injections used to be their first response to a substitution for surgery. They said, I don't really want to do surgery on my shoulder, my knee, maybe stem cell injections. But we are basically the replacement for stem cell injections, and here's why. We're non-invasive, there's no downtime, and we activate angiogenesis. So our SoftWave therapy, it's telling your body to heal itself, and it's guiding it in the process. By non-invasive, I mean there's no needles, there's no injection, there's no pricks. By no downtime, Dr. Maxwell even got a stem cell injection in his shoulder. He was not able to work for a week. It costed him, I think he said, about $7,000. And then he also lost all the money not being able to work in his practice. Here, no, we actually help promote painless range of motion instantly in some cases. And we help activate angiogenesis, like I said. Stem cell injections also cost 2 to 10 times more than we do at SoftWave therapy. And look in that top photo, that looks horrible. I hate needles. I hate getting pricked. For this, our technology kind of looks like ultrasound. We put ultrasound gel on and we'll roll it around, but it will not. It's non-invasive, no downtime, activates angiogenesis, and so much cheaper. The second thing we want you to keep in mind when thinking about SoftWave therapy is, are you kind of a good candidate? And so there's three main groups of people we like to focus on treating. It's typically adults trying to recover from a surgery, prevent a surgery in some cases, not all, I will say, not all. People suffering from acute or chronic pain. We got active seniors just seeking to enjoy life without pain, whether they've been suffering for years and years and they're like, I just like to not suffer anymore. And a bunch of athletes as well come to us just trying to get back from an old injury and mitigate the risk of injury while they're training. So this is one of my favorite slides. It shows on the right what is happening every time the applicator head is going over your tissue. And then on the left, it's kind of the dumbed down version. That's my favorite. So whenever we're going to run our technology over your hot spots, on normal tissue, you won't feel anything. You'll just feel and the light sounds. So it looks like a lightning bolt is how some people are kind of describing it, but loud. So expect loudness. On normal tissue, you won't really feel anything other than the pressure of the sound waves. But as soon as we hit a spot that has arthritis, inflammation, poor circulation, you will immediately feel, I think we put on here, a biofeedback component where the patient can express a sharp change in comfort, also known as ouch. It's going to hurt, okay? And it's supposed to hurt. That lets us know that we're working on tissue that is damaged or in pain. And so we always say you have to feel it to heal it, all right? If your body didn't feel this pain, it would not be sending stem cells to that location. And so imagine we're a tidal wave tricking your brain, send stem cells here. Now, the third thing we want you to keep in mind is why choose SoftWave therapy. There's three types of shock waves, and so I kind of want to go through and let you know how SoftWave therapy is different than all of them. And so the electromagnetic, piezoelectric, and electrohydraulically produced, which is SoftWave. So why choose SoftWave? Each one has its own niche. Let's start from the bottom up. So electromagnetic shockwave therapy was kind of the first one that was invented, created, and they used it to help dissolve kidney stones. So this treatment is actually the gold standard for dissolving kidney stones, but it was high intensity and focused. Focused meaning it had a smaller applicator head. So it was used in lithotripsy, dissolving kidney stones. It kind of evolved more, piezoelectric, focused, but low intensity. They started working on wound healing. And it's pretty crazy. I was talking to another patient the other day going, I was looking this up and it just dawned on me, who thought that, hey, we should use really fast sound waves and see if they heal the body? Like, oh, that sounds like a great idea. Let's do it. I'm amazed. I'm blown away. But I am thankful that they did because this technology works. Well, as they're studying piezoelectric and electromagnetic, they're discovering that stem cells are appearing when they're working on these areas. And so they keep evolving, keep studying, keep researching, bettering themselves. And here we are now. Electrohydraulically produced acoustic sound waves, also known as soft waves. And you can notice going from the bottom up that we're able to expand what we're treating now with the unfocused low intensity. So soft wave, we work on connective tissue. In Europe, they work on erectile dysfunction, but I'm just going to tell you right now, we do not work on that here. So although soft wave therapy is in a category of its own, extracorporeal shockwave therapy, that means it's externally applied. It doesn't mean it's the same as all the other therapies. So soft wave therapy is a type of shockwave therapy, but it's not the same as every other shockwave therapy. In fact, soft wave therapy is new to North America, about 2 years old. It came in 2020, but COVID just hit, so it kind of was a quiet release, but it has only been released to the top 0.5% of all chiropractors in North America. And Dr. Maxwell, Jeremy Maxwell over at the Wellness Way, this is separate from the Wellness Way, but he's one of the 0.5 top percent of all chiropractors in North America. And he's so thankful, and I am so thankful that we get to help people in Colombia and around with this technology just feel better and heal better. So not all shockwaves are created equal. Dr. Matthew Dedura said, what do we treat? What do we treat? That's the gold question, baby. We treat arthritis, back pain, plantar fasciitis, neuropathy of the feet. We help people with Osgood slaughters just feel better. Typically with that, you'll grow out of it. But if you're just suffering, we have helped actually quite a few people with that. Just anything, carpal tunnel, shoulder impingements, you can read the list. Like if you feel something in one of your joints, your neck, your hurts, you should come see us. Like we can help. So final question is, are you ready to feel better? Are you ready to feel better? Again, remember what I said. People don't typically come to this out of inspiration, but out of desperation. But I also want to say this to you. If you do feel inspired to say, hey, I don't want to live in pain anymore, I'm here to tell you, you don't have to. You can come see us. You don't have to wait till you're desperate before you come see us. Our technology will still work. It doesn't need to be super damaged for it to work. Any type of damage, it's helping tremendously. So I hope that this educational seminar was fun, and I hope you learned a lot, and I hope you just either come on in, try us out, let us help you help yourself, and tell your friends about it if you're a believer. So have a wonderful day.